Hey, how's it going, everybody? Sarasota Tim coming to you from Panera Bread here in Boynton Beach. Thought I'd change it up for you guys a little bit, come outside. We got some serious thunder and lightning in the area, so if you hear it, I'll run for the hills if I'm in danger. Today's video, I wanted to talk to you guys. I've been mentioning that I'm going to talk about Medicare. And Medicare is something that I won't say you have to do it because you can actually postpone it, but you really do have to do it or postpone it, or be prepared to postpone it, I should say, at age 65. Now, I'm turning 65 in December, and you have a window of 3 months before you turn 65 and 3 months after to enroll. If you negate enrolling and you don't have a good reason why you didn't by having your, let's say you have a group policy now and you're working and you want to keep that, that's fine. You can avoid the penalties if you can prove from the age 65 until the time you actually get on Medicare that you had a credible insurance policy that was with a company that had more than 20 full-time employees. But before we get too much into the detail, I'd like to give you just the cliff notes to kind of straighten out some of the confusion that a lot of people have about Medicare, because the first thing you need to do is decide. And if you are already drawing your Social Security at 62, 63, 64 years old, I started at 62, you are automatically enrolled. You will receive a card, a Medicare card, prior to becoming 65 years old, from the Social Security office. If you are one that hasn't started your Social Security yet and you want to get your Medicare going at age 65, then you need to contact the Social Security office, not an insurance company. You need to contact the Social Security Administration. But I'm going to try and speak to those that are already drawing, like myself. You're already enrolled, but you're enrolled in original Medicare, a Medicare A and Medicare B. And what that is no good. You don't want that, because Part B, Part A I think is the hospital and Part B is your doctors. But every bill, if that's all you took, and you know they're going to take $170, I think it's $167, let's just round it up to $170 to keep the math simple. They're going to take that from your Social Security for Medicare A and B. And then on top of that, if you go to the doctor, you're going to be paying 20% of any unpaid bills, because Medicare only pays 80%. So are you with me so far? So we see that's no good. I mean, it doesn't take much to go to a doctor and rack up $1,000, or if you God forbid, come down with something serious and you had $5,000, $10,000 doctor bill, you could be on the hook there for a lot of money, and that could break people. So almost everyone, of course, never stays with original Medicare. You get that, that's your government Medicare, and then you have two choices. You either have to go down this way or this way, and that's what I want to talk about in today's video. You can take A and B and turn it into Medicare C, which is the Advantage plan. I'm sure many of you have seen many commercials on TV where they have these washed up actors and stuff promoting it, where you get money back into your Social Security, you get free dental, free hearing, free vision, all these plans they throw in. And it's okay, I'm not going to disparage it too bad, but let me just give you the reasons why you may not want and why you do want the Advantage plan. The Advantage plan is basically the government says, we're going to outsource you to an insurance company. So they take the A and B and turn it into C. And now you're with either Aetna, Kaiser Permanente, all these different, AARP, which is, I forget their actual insurance name. I think it's something United Healthcare. So you've heard of all these different companies, okay? And it depends upon your zip code. What happens is people make the mistake of wanting that free gym membership and the free vision and the free dental and all these things they throw in. And the reason the insurance companies are doing that is because they're getting paid from the federal government to sell these plans. But they're not all what they crack up to be, because all of those extra benefits are nothing but dental cleanings. They're not, you know, bridges and crowns or any discounts on them. They're just preventative maintenance. The eye vision thing might be to get your eyes checked. And while they have a certain value, they're not really, I mean, dental insurance anyway is not that good. They barely cover anything. So don't be fooled by taking it for that reason. You want to take Medicare for your medical benefits. So you want to consider what is your health right now? Are you someone that, you know, genetically there's, you know, in your family a lot of cancers or different things, or are you in perfect health? Myself, I've always been in good health. I've never even had health insurance on my own because I worked for myself for 33 years. And I've only been insured recently with the Affordable Care Act, which has been good. I've had a few things done, but I haven't really had to be hospitalized. So let's get back to it. You're going to take this road we're talking about first, step one, the Advantage plan. And that gives you a no additional cost premium. And this is why it's very attractive, because you can take that A and B that you're going to have to take, that they're going to charge you that $170, but you can eliminate that 20% unlimited cap. There's no cap on it. It can be forever. You know, if you charge up $50,000 worth of medical bills, you'd be responsible for 20% of it. Where the Advantage plan has some copays and very small caps. It depends on the company. But they do offer those extra little benefits. And another downside to it is, and why it's cheap and you don't have to pay for anything extra, is it is a plan that, remember when I talked about your zip code? You have to go to doctors in a network. So you would tell them where you live, and they would say, you know, there's this plan right here for your area. Now let's say you already have a doctor and you don't want to lose them. Maybe some of these insurance companies that carry and sell you the Advantage plan, that doctor is in their group, in their network, so you can keep your doctor. But otherwise you do have to go to certain doctors. Now if you came off of a group policy when you worked and you were already in a network, you're used to that anyway. It's not really that big of a deal. But another downside to it on, you know, having health care for your retirement years is if you go for the Advantage plan, it doesn't travel very well. So God forbid something happened to you down the road and you would like to go to the Mayo Clinic or the big cancer clinic in Texas or other places, you may have a problem there. So while you get, you know, a free gym membership, or it's going to cover vision and some dental cleanings during the year, these are little policies you can buy for next to nothing extra anyway with the other plan that we're going to talk about next. So the Advantage plan just keeps you from paying what I'm going to talk about now. Phase two. Now this is for people that money's not a problem. Step one there, the Advantage plan, are people that just don't have a lot of money. They don't have any extra savings. They have a smaller Social Security check, and they just, you know, they have to take Medicare. They're going to be charged at $170 anyway. You know, that might be what you're forced into, and stay within your network. But if you're willing to pay a couple of $100, or let's say $125, $140 to $300, it depends on the state, but we're going to take an average of about $150 to $200. It's called a supplement plan. So you remember that 20% that you would be responsible for with standard Medicare A and B? By taking a supplement plan through an insurance company, you fill in all those gaps and you have no other out-of-pocket expense. But you pay, in addition to losing that $170 every month, and this is what they don't talk about on YouTube. They talk about how much the plan costs, but they forget to tell you you're still paying that $170 that they're going to take from your Social Security. So now you're basically $400 less a month that you're losing because you're going to take a supplement plan. But this is very appealing, because let me tell you what it does. it's standardized. So the government has 10 of them, but we're only going to talk about 3. G, N, and high deductible G. So really 2, G and N. As of 2020, the F is no longer available, which is the G now. But the G has one less thing. Well, now you don't have any other charges anymore with the G plan, except that Part B deductible, that 20% I talked about. There's a $226 deductible that you would have to meet. Otherwise, all other holes are filled. There's no other charges. And you want to go to the doctor? Go pull a doorknob at any doctor's office in any town in America. If they take Medicare, you don't have to ask them, do you take my plan? They take it. And it's about 99% of every doctor in this country. So that's a freedom that you have right there, that you're getting for that $150 a month. But it can be as much as $200 a month here in Florida. That's what I'm looking at. So that's called the subsidy plan or the Medigap plan. They use 2 different words there to describe it. So regular Medicare, switch it into the Advantage plan, get those little benefits, no additional money, just your 170's gone, and go to their doctors, or plan 2, take a supplement plan, get a price. Now here's the key. If you go with that, here's another bonus. Besides being able to go anywhere you want, any doctor, any specialist, everything is covered. Hospitals, no other charges except on the G plan, that $226 that meets that Part B deductible. So the second big advantage to the G plan and paying for a supplement plan is, it's good news, is the G plan, whether you get it with Aetna, Permanente, Kaiser Permanente, AARP, any of the big insurance companies you've heard of, there's several, 40 of them. It's the same. There's no difference. You don't get any less services. A G is a G is a G. The only difference is what they charge you for it. Some insurance companies, believe it or not, and depending on your state, will charge you different. I've seen as low as $110 a month, only extra over the $170 for the G plan, like in North Carolina. But here in Florida, it's like $200 because everything's more expensive in Florida, and New York is the most expensive. So it does depend on the state you're in. So what you need to do is you just get a price. You call one of these agents, anybody, easy to understand, helpful agents. Now you don't pay them anything. They don't get any extra money whether you buy it from them or the insurance company. The insurance company pays them. So naturally that's why they all call you, because they want to get the commission. But it doesn't cost you any extra. But what's good about some companies is they will search for you the lowest cost plan. Like if I want to get a G plan and I want to pay extra $200, I'm going to ask them, is it Aetna? Is it Kaiser Permanente? Is it going to be AARP? Because it's all going to be the same coverage under the G plan. It's just who sells it the cheapest. And then you want to check every couple of years, because you could switch during open enrollment. These companies do change their rates, you know. So if you've been on Medicare already for several years, it could behoove you to contact during open enrollment an agent now and say, am I paying $50 or $70 more than I need to for a G plan or an F plan or an N plan? There's all these other plans, but don't worry about that. The G plan is what everybody goes with, or the N plan. But they're very negligible as far as the cost. The G is the way to go. If you're going to spend the money, get the G. If you don't want to spend the money, go with the Advantage plan. Simple as that. But you can't stay with Medicare A and B only, or you're going to be taken up the river, because you're responsible for an unlimited cap of 20% charges on all your doctor visits and fees. And here you will have all those holes filled in. So what is $200 times 12 months? In Florida, for me, for a G plan, would be $2,400 a year. Plus, I'm going to be paying the $170 a month, which is $2,000 roughly a year. So I'm looking at what's 24 and 2? It's $4,000 a year. It's going to cost me to be insured. So you can see right away the Advantage plan is very appealing to people, because there's no additional fee other than what they make you pay, that $170. So that's a simplified version of it. If you have the money and you like to travel and you think that you might incur bigger illnesses, or you go to the doctor frequently and you don't want to be corralled into using just certain doctors, or you might want to move to another state or go to another hospital or something for a bigger issue of cancer or anything like that, and then you might want to stay away from the Advantage plan. But if you're one that's just price conscientious, you can always switch later, but there's some rules about switching where when you first sign up, it doesn't matter what your health is. There's no questionnaire, there's no refusal. But if you switch later from the Advantage plan, there's a health questionnaire, or an underwriting they call it, where they ask you questions where you may not be able to get on those supplement plans. Now, if you're taking blood pressure medicine and cholesterol, that's probably not going to be a problem at all. But if you were to have to answer a question that you've encountered, another serious illness or a cancer, you could be stuck where you're at. So those are the things you want to consider. Advantage plan and supplement plan, but definitely don't just accept A and B. Make your decision, call a couple of agents and ask them to give you a price on that G plan with all the companies that sell the G plan in your area. And it doesn't matter who sells it. Remember, they're all the same coverages. There's not going to be any difference. The G is the G. But it's just the price. What company? Is it Aetna? Is it going to be the cheapest? Is it AARP who's going to be the cheapest? And some people you call, they may only write, through a few companies. Find somebody that can write this insurance from, 40 different companies so you can get the best price. And also remember what I said earlier too, if you've been on Medicare for several years, check and see if you're the lowest price you could be right now. I know things always go up, but maybe there's a plan that hasn't gone up as much as yours, and if you're on an F plan or a G plan now, maybe you could be saving money. So before the rain gets ready to come down, I'm going to put this phone in my truck and crush it.